On June 23rd, the Centers for Medicare and Medicaid Services issued a new frequently asked questions sheet, clarifying guidance on both the Families First Coronavirus Response Act and the CARES Act. This was actually part 43 in their frequently asked questions series. They have been trying to clarify a lot of the provisions coming out of the three agencies that have been tasked with implementing both of these acts: the Department of Labor, the Department of Health and Human Services, and the Treasury. The discussion in this new release, in the Frequently Asked Questions Part 43, centered first on Section 6001 of the Families First Coronavirus Response Act. This is the section that generally requires group and individual health plans to provide benefits related to the testing or diagnosis of COVID. And the duration begins March 18th until the national emergency ends. It requires coverage without cost sharing, without prior authorization, or without other restrictions. The CARES Act then works on top of Section 6001 and actually offers a broader range of diagnostic items and services that then enhance that section. But there's a lot of nuance to it. What's covered, what's not, what fits into that description of services, benefits, and treatments for COVID, and what doesn't. So this is what the three departments were tasked at trying to explain. And here are a couple samples coming out of that frequently asked questions that are important. The department clarified that self-insured group health plans must indeed comply with this Section 6001. It also clarified that plans and issuers are indeed required to cover COVID tests intended for at-home use. And it also said plans must cover facility fees charged for a visit that does ultimately include a COVID test, even if that was not the original intent when somebody went in for the service. So a facility fee must also be covered. So three clarifications: self-insured plans, in-home testing, and a facility fee. All must be covered under 6001. But here's the clarification that had a lot of people shaking their heads. It's also, in this frequently asked questions, clarifies that COVID testing for surveillance or employment purposes does not have to be covered, at least under this section, under Section 6001 of the Families First Coronavirus Response Act. The rationale was that the language in the act required coverage of items and services for diagnostic purposes as outlined in the guidance, and testing conducted to screen a general workforce is beyond the scope. They said that surveillance piece, or to see how an employee is doing, is not considered diagnostic. Well, like we said, some people are shaking their heads at this a little bit. The concern with the interpretation comes at a time when the number of people with the virus is actually increasing. If we're actually going to try to stem the spread of the virus, people are saying that conflicts with this rationale here. We want to encourage people to go get testing, especially those employees that are in high-risk jobs. So having an employer ask their employee to get regularly tested, you would hope would be encouraged. Now, make sure when you are indeed going in for testing or diagnostic services, make sure you understand what the test is, what the purpose of the test is, and be sure to ask any charges that you believe will be assessed with that visit, with that test, with that diagnostic visit. Know and understand the costs going in, and make sure that you are keeping good notes as you go through this. Know what's required by your workplace and know what your insurance will cover. And keep in mind, many communities still are operating free test sites where they won't even ask for insurance coverage. Many communities have taken on that role themselves to make sure that they can, like we said, help stem that curve of the virus and just make sure as many people can get tested as possible. We share that frequently asked questions, part 43, in the description below. As new clarifications come out of these three agencies, we will bring you updates.